morning everyone. I'm Mrs. Deepika Sri from the Allied Health Sciences. Now we are going to see about the topic is leukoplakia. So leukoplakia is one of the conditions that occurs in a tongue. This is called leukoplakia. So in leukoplakia, it is caused thick white patches that form on the gums. The patches also may form on the inside of the cheeks and the bottom of the mouth. Sometimes the patches forms on the tongue. These patches can't be scraped off. So this is for the leukoplakia. And the etiology of leukoplakia is the exact causes of leukoplakia is mostly unknown, but long-term irritation from tobacco use of smoked and smokeless appears to be strongly related to many cases. So in the picture we can see that leukoplakia. So this is a leukoplakic mouth. So long-term heavy use of alcohol, jagged, broken or sharp teeth rubbing on a tongue surfaces, broken denture or dentures that do not fit well. So this is called etiological factors for the leukoplakia. And the risk factors and complications of the leukoplakia. The risk factors are usage of the tobacco, particularly smokeless tobacco. The long-term use of some edible products which are we soaked on our mouth in this so this causes the leukoplakia. We soak on we can store it on our edge of the mouth, so it's spread to the inside of our cheeks area. That means this part of the gums and the tongue. So wherever the saliva touches, that part also change into a dark whitish color. So that color we call it as the leukoplakia. And the complications of leukoplakia are usually do not cause permanent damage to the inside of the mouth, but leukoplakia increase the risk of the mouth cancer. So mouth cancer often form near leukoplakic patches. For example, the 10% of the mouth cancer occurs means from that the 4 to 7% because of this leukoplakic induced cancer. So this is the risk factors and complications of the leukoplakia. Another one is symptom of leukoplakia. The symptoms of leukoplakia is leukoplakia may appear as white or grey patches that can't be wiped away, and patches with a rough, rigid, wrinkled or smooth surface or a combination of these. Patches with shapes and edges that are not regular, thick or hard patches. Okay, the hairy leukoplakia is another one type of this leukoplakia. In hairy leukoplakia, we can see here this is the hairline structure we can see. So this is the hairy leukoplakia. This hairy leukoplakia causes fuzzy white patches that look like folds or ridges. The patches usually form on the side of the tongue. Hairy leukoplakia is often mistaken as oral thrush, an infection that causes creamy white patches that can't be wiped up. Oral thrush also is common in people with weak immune system. So this is the hairy leukoplakia. It is the this is the important point. In the oral thrush also is common in people in weak immune systems. Okay. And the diagnosis. So history collections, that means history about the soakage of any edible material is inside the mouth for the prolonged period. So this is that is the main important thing we have to ask to the patient. So history collections. Another one is any genetic causes. Genetic causes regarding the cancer. Okay, and another one is physical examinations. So in physical examinations we can find out the whitey patches. And the two type of examinations. So biopsy, that means oral brush biopsy. Another one is excisional biopsy. In oral brush biopsy is in this test cells are removed from the surface of the patches with a small spinning brush. This test does not always give a defined diagnosis. Okay. Another one is excisional biopsy. In this test, the small piece of tissue is removed from the leukoplakic patches. So that this is the actual biopscopic method. If the patches is small, the entire patches may be removed, and the excisional biopsy usually results in a definite diagnosis. So this is the diagnosis of the leukoplakia. Another one is treatment. There are three methods of the treatment. One is conservative management. Conservative management, in the conservative management, we have to change the lifestyle modifications. So lifestyle modification regarding the if the any edible material we can soak for the prolonged period means we have to stop it. That means cessation of the habit. So this is the comes under the lifestyle modification. Another one is surgical management. The surgery to remove the leukoplakic patches may be removed using a small surgical knife, a laser or a tool that use heat or the tools that use extreme cold also can remove the patches and destroy the cancerous cells. So this is the another way. And the treating of the hairy leukoplakia, we can see the frizzy type leukoplakia, right? So for that, antiviral medications. And these medications can keep the Epstein-Barr virus, the causes of hairy leukoplakia under control. So this is the management of the leukoplakia. So these are some important points we can discuss about leukoplakia in this video. Hope you all understand. Thank you.